How to navigate changes to Medicaid. In this video, you will learn about changes coming to Medicaid for some immigrants starting October 1st, 2026. We will also share tips to help you prepare if you lose Medicaid and need another form of health insurance. First, let's talk about the changes. Depending on how you entered the United States, you may have applied for or received public assistance, such as Medicaid or SNAP, also called food stamps, when you first arrived. Due to changes made in 2025 by the federal government, many have noticed changes with their SNAP. For example, immigrants with refugee status are no longer eligible to receive food stamps unless they have a green card. Due to those same federal changes for SNAP eligibility, Medicaid eligibility is also changing on October 1st, 2026. Starting on October 1st, 2026, the following groups will no longer be eligible for Medicaid unless they have legal permanent resident status, also known as having a green card. These groups include refugees, asylees, humanitarian parolees, victims of domestic violence or trafficking, and individuals who have deportation withheld. However, there are some exceptions. This change does not include women who are pregnant or who are within 12 months postpartum, and it does not include children under 21 years. They are exempt from the changes. If you are one of the families with any exemptions due to pregnancy or children being under 21, you must follow the instructions shared by the Pennsylvania Department of Human Services. If you have questions, you can visit or call the County Assistance Office to ask your caseworker your questions. For immigrants living in Allegheny County, Pennsylvania, the best office to go to in person is the downtown office at the Warner Center. Some immigrants who lose federally funded Medicaid may still qualify for a Pennsylvania health insurance program called medical assistance. However, medical assistance has lower income limits, so some people who qualified for federally funded Medicaid may not qualify for state-funded medical assistance. So, how will you know if you qualify for government-funded health insurance or not? Your county assistance office will send out letters to all those who may be impacted by the new change. The Pennsylvania Department of Human Services is required to send these letters to anyone potentially affected at the home address they have on file. Therefore, make sure you have updated your contact information with your county assistance office, such as language preferences, address, email address, and phone numbers, so you can receive important notices by email, mail, or phone call. Answer any calls you receive and check your voicemail for missed calls. It may be a person at the county assistance office trying to reach you. Make sure to provide any information the county assistance office requests. The county assistance office will assess if you are eligible for any government health insurance. Remember that the county assistance office employees are mandated to use interpretation when requested. You can always request an interpreter by saying, "No English," and then your language. If you would like someone to help you, you can choose a trusted person to appoint as a representative. The county assistance office will need the name and phone number of this person to contact them and will update them on any changes related to your case. If you do not speak English yet, you may want to consider someone who understands English. If you do lose Medicaid and aren't eligible for other government-funded health insurance, what are your options and what are the next steps? One option many people might consider is to be uninsured. However, for anyone living in the United States, medical care without health insurance is expensive. If you do not have a health insurance plan, you can still receive medical care, but you will be responsible for paying out of pocket. This means that you are responsible for covering all costs of the medical care you receive, whether you are attending a routine checkup, being transported to a hospital in an ambulance, or are staying at the hospital to receive care. If you live in Pittsburgh, there are free, low-cost, and sliding scale health clinics that you can utilize to help save costs on medical care. However, they can sometimes be hard to access due to long wait lists. There's a link in the comments that includes a list of clinics that is up to date as of June 2025. Or you can use Google to search for the most up-to-date information. Due to the high costs of paying for health care without insurance, it's important to find another health insurance option if you can. For people who are not eligible for Medicaid or other government-provided health insurance, the two most common options are employer-provided health insurance or private health insurance. The most common way people receive health insurance is through their employer. If your job offers health insurance, usually your job pays part of the cost of the health insurance, and you as the worker pay part of the health insurance too. Each employer is different, so some employers may cover more of the cost, whereas some employers have the workers cover more of the cost. Some employers do not offer health insurance at all. Your employer should have a staff member available to explain more about the health insurance options at your job, so it's important to ask when you have questions. For families where both parents work, it is important for each adult to check with their employer about health insurance benefits. It is possible that your employer does not offer health insurance, but your spouse's employer may have a plan that covers all members of the family. Each health insurance plan is different and will cover different things, like doctor's visits, medications, and emergency room visits. If your employer does not offer a health insurance plan, then other options still may exist for you. The next option is to buy private health insurance. Private health insurance is health insurance that is not provided through your employer and is not public assistance. If you live in Pennsylvania, you can search the different private health insurance plans through something called Penny. Penny is Pennsylvania's marketplace to choose private health insurance. Penny offers many different health insurance plans which have different costs. The cost for each plan usually changes each year, usually increasing. To summarize, changes are coming to Medicaid on October 1st, 2026. You will want to be proactive by making sure your contact information is updated with the County Assistance Office, submitting any requested documentation to the County Assistance Office on time, and once your Medicaid stops, selecting and enrolling an alternate insurance plan either through your employer's insurance or Penny. If you become uninsured but have a health emergency, you should still call 911 and go to the emergency room. Hospitals often have social workers who can help you explore options for paying for your health care. For example, you may qualify for emergency medical assistance, which is financial help that is for very specific, sudden, and severe life-threatening conditions, rather than a substitute for long-term health insurance. Hospitals can also help explore payment plans and other options. If you are an immigrant living in Allegheny County and you need help with paperwork you received from the Pennsylvania Department of Human Services about your Medicaid, please contact the ISAAC program. There is a link in the comments to their webpage. We hope this video provides helpful information about the upcoming changes to Medicaid and provides options for you and your family to find alternate health insurance if you lose your Medicaid coverage.